Good morning, everyone. Happy to be back with you this morning. And today, I'm going to do a little topic. This is going to be a brief topic this morning on brain health, something that a lot of us take advantage of and is not mindful how important our brain is. And so this morning, I want to touch on that a little bit. We take care of everything else in our body, but we don't take care of our brain. So let's get started. So what is brain health? So brain health is a state of brain functioning across cognitive, sensory, social, emotional, behavioral, and motor domains, allowing a person to realize their full potential over the life course, irrespective of the presence or absence of disorders. As people age, the brain naturally changes, affecting memory, learning, and other cognitive functions. Your brain determines every aspect of your life. It works tirelessly for you 24 hours a day, 7 days a week. Conditions affecting the brain and nervous system in general emerge throughout the life course and are characterized by disruptions in brain growth, damage to brain structure, or impaired brain functioning. These include, for example, congenital or neurodevelopmental conditions, as well as neurological disorders across life. Health and social care for those conditions require multi-sectoral and interdisciplinary collaborations with a holistic person-centered approach focused on promotion, prevention, treatment, care, and rehabilitation, and the active engagement of persons with lived experience, their families, and peers. So, with all the things that happen with our brain, a lot of us, we take care of a lot of other things and we're not doing this. So I want to give you some recommendations for your brain to keep it healthy. And some work for some people, it may not work for some, but these are just some recommendations. So exercise. Exercise has many known benefits, and regular physical activities also benefits the brain. Multiple research studies show that physical active people are less likely to experience a decline in their mental function and have a lower risk of developing things like Alzheimer's disease. So you want to aim to exercise at least 30 to 60 minutes per week, a few days a week if possible. You can walk, you can swim, play tennis, or do any other moderate aerobic activity that increases your heart rate. Get plenty of sleep. This is my favorite thing, by the way. Sleep plays an important role in your brain health. Some theories state that sleep helps clear abnormal proteins in your brain and consolidates memories, which boosts your overall memory and brain health. Aim for 7 to 8 consecutive hours of sleep per night, not fragmented sleep of 2 or 3 hour increments. Consecutive sleep gives your brain the time to consolidate and store your memories effectively. You want to eat a healthy diet. Your diet plays a large role in brain health. Consider following like plant-based diet, more foods, whole grains, fish, healthy fats such as olive oil. It incorporates less red meat and salt than a typical, what we call American diet here. And studies have shown very closely that the people that want a diet like the Mediterranean diet are less likely to have Alzheimer's disease than other people who don't. So think about that. 4, you want to stay mentally active. Your brain is similar to a muscle. You need to use it or lose it. There are many things that you can do to keep your brain in shape, such as doing crossword puzzles, reading, playing cards, putting together jigsaw puzzles. Consider cross-training your brain. Incorporate different types of activities to increase the effectiveness. Your brain can get a good workout through reading or challenging yourselves with puzzles. And especially now with the kids out of school, you want to promote this with them as well. Finally, don't watch too much television, as that is a passive activity and does little to stimulate your brain. You want to remain socially involved. Social interaction helps ward off depression and stress, which can contribute to memory loss. Look for opportunities to connect with loved ones, friends, and others, especially if you live alone. Research links solitary confinement to brain atrophy, so remaining socially active may have the opposite effect and strengthen the health of your brain. You want to keep your blood vessels healthy. The health of your arteries and veins is important to your heart health, but is also critical to your brain health. Get your blood pressure, blood sugar, and cholesterol checked regularly, and take steps to keep your numbers within a normal range. Increase your physical activity, like I spoke about. Eat, you can try a Mediterranean diet, and decrease your sodium consumption to lower blood pressure and cholesterol values. Finally, tobacco smoking and alcohol use also impact brain health. So now you want to see if you have good brain health. Your provider can do a thorough checkup, asking you specific questions, and may refer you to a neurologist. Then there's what's called the brain checkup. It's a simple and easy thing. Guess what? You can even download that on your smart device. And they have questions that you can answer to test you and to see how well your brain is doing. So healthybrain.org provides you with tools, resources, and a community to empower you to take actions to help improve your brain health and lower your risk of brain disease. So it's called healthybrains.org. So vitamins, something again that I talk a lot about, and I promote that as well. So some vitamins that are recommended for the brain, it may or may not work for you, depends on if you're on any kind of medications. You want to make sure that your doctors are aware that you may take these vitamins. Your omega-3s, your B vitamins, vitamin E, L-theanine, curcumin, coconut oil, ginseng, and ginkgo biloba. These are things that a lot of people use for brain health. In conclusion, reminder that the summer slump is real when we don't include brain healthy activities into our schedule. So as you focus on keeping yourself and your family physically active this summer, become intentional about brain fitness as well. Today, we live longer and we live healthier. Our heart, our joints, and the rest of our bodies can outlive our brain. Your lifestyle has a profound impact on your brain health. Unlike aging and genetics, you have control over your lifestyle choices. In conclusion, I want to give special acknowledgement to WebMed, Mayo Clinic, World Health Organization, the Center for Brain Health, and the Cleveland Clinic for the information that I provided you today. I hope this was helpful. Please make sure you take some of these advices, especially doing the brain health check. Have a good day and God bless.